Alrighty, so the physician has requested an ABG from this patient, so I've confirmed that this is the correct patient along with their name and date of birth. I've introduced myself, I've explained what we're going to do, what an ABG is, and why we take it from an artery. I've already performed the Allen's test, and they do have adequate circulation to go ahead and draw this ABG from them. So I've already gathered all I washed my hands, put on gloves, then gathered my supplies, laid them all out so that we're ready to go. So I'm going to go ahead and use the alcohol wipe here, clean the area, clean my fingertips. I've got gauze here ready, I've got my Band-Aid here ready, along with my cork so that I can quickly cork that and make sure that I don't poke myself or the patient. So I'm going to go ahead and remove this cap off this needle. And I'm using the smaller of the needles, the 23 gauge. I'm going to draw this back to the correct amount of blood that the sample needs to be, and it's 1 milliliter for this patient. So I'm going to draw that back. Got my gauze placed. I'm going to go ahead and palpate. And then while holding this needle like a pencil at a 45-degree angle and bevel side up, I'm going to slowly insert it into the artery until I see the blood pulsing into the syringe. If I don't hit the artery initially, I can slowly draw back the needle and then kind of replace it. So once that has filled up with blood, I'm going to grab my gauze that was here and just apply pressure while slowly pulling out the needle. And apply pressure to where we punctured the needle. And then I would go ahead and I would cork this needle so that it doesn't poke anyone. So I'm going to go ahead and apply pressure for about 3 to 5 minutes depending on this patient. Once that time is up, I'm going to apply the Band-Aid there. So this would be corked, and I would go ahead and dispose of this in the sharps container. I'm going to go ahead and put the lid back on this syringe. So closes that up. Then I'm going to draw up a label, and so this should include the patient's name, the date and the time that this is drawn, the FiO2 that the patient is on, and then the site of the draw and initial it. And then I would send this along with the syringe in a biohazard bag over to lab. Thank you.